السلام عليكم ورحمة الله وبركاته. كل عام وانتم بخير. Long-term outcome of horizontal root fracture in permanent teeth, a retrospective cohort study by Mashid et al. In 2024. This study, it is retrospective study. In general, the horizontal root fracture is a complex traumatic dental injury that affects the pulp, dentine, cementum, and periodontal ligament. This study evaluated treatment outcome in permanent teeth with horizontal root fracture. So the aim of this study to assess long-term outcome of teeth with horizontal root fracture and investigate the prognostic impact of trauma-related and treatment-related variable on healing the fracture line. The method of this study: 125 teeth from 103 patients were included. We analyzed the clinical and radiographic data from Dental Trauma Center in average period 12 years. The permanent teeth with horizontal root fracture with follow-up up to 12 weeks. The outcome measure radiographic healing of fracture line was categorized into 4 types based on the classification by Andreessen. As we can see in the figure 1, radiographic progression of healing in horizontal root fracture cases with different type of healing. These figures show cases preoperative, postoperative, and follow-up radiographs of 4 teeth with horizontal root fracture. The type of healing is classified according to the Andreessen and Hansen classification. In case 1, healing with classified tissue fragment in close contact and minimal fracture line, which cause type 1. In case 2, healing with interproximal connective tissue fragment appeared separated by narrow radiolucent line and fracture edge appeared rounded, which called type 2. In case 3, healing with interproximal bone and connective tissue fragment separated by bony bridge and called type 3. The last one, case 4, non-healing with interposition of granulation tissue evidenced by widened space between fragment or radiolucents adjacent to the fracture line and called type 4. So the result of this study showing higher prevalence of horizontal root fracture in male affecting maxillary central incisor with fracture mainly located in the middle third of the root. And 92% of fractured teeth healed successfully. 96% of teeth were saved, not extracted. And the best healing apical fracture young patient early treatment. However, the worst healing cervical fracture delayed treatment older patient. So the conclusion of this study: the horizontal root fracture can heal favorably under the right condition, and early diagnosis, proper splinting, and monitoring the pulp vitality are important for success treatment. And long-term follow-up are essential for detecting complication. Thank you.